Now here we discuss about the dissection of the uterus. So this is the uterus. The anatomical location of uterus is in the lesser pelvis. It is located behind the urinary bladder over here and in front of the rectum. So this is the anatomical location of the uterus in females. Then the parts of uterus, there are two parts. First is the body and the lower part is the cervix. This body has been divided again into two parts. The part which is above the line joining the two fallopian tubes, this is the fundus and this is the body. And the lower part is the cervix. Cervix is again divided into supravaginal and the intravaginal part of cervix. Supravaginal means the part which is above the vagina, and the lower part which is inside the vagina, this is the intravaginal part of the cervix. Now this is the fallopian tube. Here we can see there are two fallopian tubes and this is the ovary. So it is connected from the fimbriated end of the uterus with the help of this ligament. This is ligament of ovary. Now the measurements of the uterus. First, the body. The length of the body is 5 centimeter. Then the length of the cervix is 2.5 centimeter. So the total length is 7.5 centimeter. Then the thickness is 3 centimeter and width is 4 to 5 centimeter. Then the relations of the uterus. On the anterior side of the uterus, we can see it is related to the superior surface of the urinary bladder. So here we have the urinary bladder which is related on the anterior side, and the peritoneal fold between the uterus and the bladder, this is the uterovesical pouch. Then on the posterior side of the uterus we have the rectum, and the peritoneal fold between these two organs is recto-uterine pouch of Douglas. Then there are lateral borders of the uterus. These are the two lateral borders of the uterus. The lateral border is connected with the lateral pelvic wall with the help of this ligament. This is broad ligament on both the sides. So this broad ligament connects the lateral borders of the uterus with the lateral pelvic wall, and then this ascends from the floor of the pelvis. From the floor of the pelvis, this is attached up to the fallopian tubes. So this complete is your broad ligament. This broad ligament has two surfaces. One is the anterior surface, other is the posterior surface. Two borders are there in the broad ligament. This is the upper free border and this is the lower border which is attached on the pelvic floor. Then the parts of this broad ligament. First part is the meso-ovarium, which is connecting the ovary with the lateral pelvic wall. So this is the meso-ovarium. Then mesosalpinx, this is between the ovary and the fallopian tube. This is the mesosalpinx part of the broad ligament. This is nothing but the peritoneal fold. And mesometrium, this is from the pelvic floor up to the uterus, up to the fallopian tubes and the ovary. This complete portion is the mesometrium, which is a part of broad ligament. Then contents of broad ligament. These are uterine artery, ovarian artery, the fallopian tubes, and ipophoron or parophoron. The blood supply of the uterus is via the uterine and the ovarian artery, and the lymphatic drainage is important as the carcinoma of uterus are very increasing today. So it should be noted that the lymph from the fundic part of the uterus is going towards the para-abdominal or abdominal aortic group of lymph nodes, and from the body of uterus it is draining into the external iliac group of lymph nodes, and from the cervical part of the cervix of the uterus it is draining into the internal iliac group of lymph nodes. So this completes the dissection of uterus. Thank you.